Hi everybody, it's Dr. Marissa Tenenbaum from West County Plastic Surgeons. Sorry I'm a little late. Was just having some technical difficulties with Facebook Live, so I'm on my phone, so I apologize for some of the movement. We are talking today about Mommy Makeover. So briefly, I'm going to kind of try to explain what that means because I know it can be somewhat confusing. But mommy makeover is generally a term used to describe a combination of procedures that typically involve abdominal and trunk contouring as well as breast surgery. However, it certainly can involve a lot more than that. It's sort of a term that is kind of describing changes after pregnancy and childbearing in terms of abdominal wall laxity, fat deposits in different areas, weight gain, etc., skin stretching, loose skin, that kind of thing in the abdomen and breasts. So oftentimes it may involve a tummy tuck or abdominoplasty. So abdominoplasty or tummy tuck can be, a whole Facebook Live session on its own. So I'm not going to go into complete detail on all of these different procedures. But a tummy tuck, as many of you may know, is a procedure that helps remove excess skin and fat in the abdomen. So, for example, stretched out skin with stretch marks or loose overhanging skin, etc., that can be removed. And then often we also can tighten up the muscles of the abdominal wall that get stretched out after pregnancies. We often will also combine this with liposuction. So I love to combine this with liposuction of the circumferential waist and back, basically the entire trunk. Not every woman is going to need that. So it's a really individualized approach to your anatomy, your goals, and what you need, as well as your budget, etc. But many women who benefit from abdominoplasty may also benefit from that circumferential liposuction of the waist. And then sort of the second kind of part of mommy makeover often involves breast surgery. And as many of you know from other educational videos we've done, breast surgery can involve lots of different things. So there's no one size fits all for a mommy makeover. It really depends on your anatomy, your goals, etc. So it could be anything from a breast lift, a breast reduction and lift. It could be a breast augmentation with implants. It could be a breast augmentation with fat transfer or fat injections. It could be a breast lift and an augmentation if you need a lift, but you also want or need some added fullness or volume. Similarly, it could be a breast lift with fat injections. With some of these procedures, like breast lifts or breast reductions, sometimes we also add absorbable meshes that can act like an internal bra or a sling. We can often do other areas of liposuction. So from head to toe, liposuction of the chin, the arms, the lateral chest, the upper back. We already kind of talked about the abdomen and the circumferential waist, thighs, knees, ankles or cankles, if you will. All of those could be combined and sort of bunched under that category of mommy makeover. So typically breasts and trunk. Truthfully, sometimes we, depending on, again, goals and the health of the patient, we may even add more procedures such as arm contouring or thigh contouring, facial procedures like fat injections to the face or eyelid lifts or neck lifts, things like that. Again, depending on kind of everything else that's going on, your surgeon is going to evaluate you, your anatomy, listen to your goals, and determine kind of what procedures you may benefit from, as well as the combination of procedures that your surgeon feels safe performing in conjunction versus, if there's more that potentially you want to do or your surgeon wants to do, you may be told by your board certified plastic surgeon that, hey, listen, that might be a little bit too much to do in one surgery. Let's space this out over a couple of surgeries. But it is extremely common to combine breast surgery and abdominal surgery, like tummy tuck and breast lift or breast reduction, etc., in one surgery. And because of that, sort of coined mommy makeover. So a couple of nuances about that. Some people will be interested to know whether or not that can increase risk of complications. So certainly complication risk exists for every surgery. And if you have multiple areas of surgery, you can have multiple areas of complications, unfortunately. That is part of having surgery. Complication risks also can go up the longer the surgery is, which is why I said earlier that occasionally your surgeon may say, okay, I think we've reached a threshold of where I think this might be too much to do in one day. Or sometimes I might tell a patient that I think from a recovery standpoint, I don't think it's the best combination. What do I mean by that? So a really good example is abdominoplasty with a Brazilian butt lift or fat injections to the tush area. And the reason for that, although it's amazing to combine those things because often you're doing a lot of liposuction with a tummy tuck and circumferential waist liposuction, and you may want to use that fat and inject it someplace like the tush. From a recovery standpoint, I find that difficult because when you're recovering after an abdominoplasty, I want you to be in a flexed type position to take tension off of your abdomen. So that means when you're sleeping in bed, you're sort of in a what we call a beach chair position or a recliner chair position. So meaning your back is elevated and your knees are elevated so that you're bent at the waist. Well, when you're in that position, you're putting a lot of pressure right on your bottom. And when we do fat grafting to the bottom, we don't want any pressure there. So positioning yourself after surgery becomes difficult if we combine those procedures. And so that's something that I don't love to combine. But another common thing I would combine with breast and trunk surgery would be potentially smaller procedures to the face. I wouldn't necessarily want to add a full face or a neck lift, but like an eyelid lift, a lip lift, or fat injections to the face is something that could very easily be combined with Mommy Makeover. It's also important to know with any body contouring procedure and any breast surgery procedure that it's really important that you have a good, healthy, stable weight because as you all know, things change with weight gain or weight loss. Things can really change. And so typically my recommendation is that you are at a good, healthy weight for yourself. In an ideal world, you're at your ideal body weight. I know that that is not always the case. We want you to at least be at a healthy weight because it decreases risk of complications for the surgery. But it also needs to be or should be a weight that you can maintain over time. So for example, if you are planning to have these procedures and you want to lose weight and so you kind of crash diet and lose 30 pounds leading up to your surgery, and then you have surgery, but it's not a weight that you can maintain and you gain back those 30 pounds, you're probably not going to like your results. Things are going to change quite a bit. On the flip side, you also don't want to go through these procedures and then lose 30 pounds after the fact. I always tell patients after a tummy tuck, a bit of weight loss often doesn't look bad. Sometimes it can actually even look better. Although your skin may be a little looser and you may just simply wish you had waited a bit longer to have your surgeon remove that skin. But breast surgery can be particularly vulnerable to changes after weight fluctuations, either weight gain or weight loss, and especially the up and down of weight gain and weight loss. The breast can age more quickly, and that can lead to more dissatisfaction with potentially your results or potentially moving on to a revision type surgery more quickly than you otherwise would have if you had a stable weight. So that is really important. The other thing, and I know I've said this on some of my videos before, but it bears repeating that going into any surgery, whether it is breast surgery, body surgery, the fitter you are going into surgery, you will bounce back and recover more quickly. So, you know, working out, being very fit, being very healthy, active, eating a good diet to promote recovery and healing and having, good cardiovascular endurance, etc. Believe it or not, it makes recovery easier. And so I always recommend that people leading up to surgery take great care of themselves. They work out and try to be as healthy as possible. You'll bounce back more quickly. And then when I do release you back to exercising, usually you can get back into that exercising more quickly as well, which always makes everybody feel better. Another couple of items about recovery. I mentioned healthy diet. Healthy diet can mean a lot of different things to a lot of different people, but to me, a healthy diet means feeding your body really good, clean, whole foods that are full of vitamins and minerals, as well as micronutrients. So the phytochemicals, the antioxidants, etc., that we find in fruits and vegetables are incredibly important. And eating them is always the best thing rather than necessarily taking a multivitamin. So you want to eat the food because the food is really what contains the antioxidants and the phytonutrients that really help your cells on a cellular level heal and recover. And so that's also really important for postoperative healing. And so again, you want to go into these surgeries really well prepared and then be really well prepared for healing afterward. Of course, I always have to say that if you are contemplating any of these procedures, you should seek a consultation, of course, with a board certified plastic surgeon. It's not unreasonable to have more than one consultation. Sometimes it can be really educational to hear opinions of differing surgeons that both may be excellent surgeons, but they may have slightly different ideas about helping you accomplish your goals. And sometimes it can be really educational to hear those opinions more than once. Sometimes the surgeons might actually have the exact same opinion, and maybe it was slightly different than what you thought you would hear. But when you hear it more than once, it makes it a bit more palatable. Like, okay, all right, maybe I was hoping for liposuction of my abdomen, but now I've had 2 board certified plastic surgeons tell me that I'm not going to be happy with liposuction and that really I would be a lot more happy with a tummy tuck or an abdominoplasty. So getting more than one opinion often can be helpful. Making sure that you have support from your friends or family after surgery is super important as well. You need to give yourself the best chance of recovering and recovering well. And so having friends and family that can help out with driving you to the hospital, driving you to appointments, helping with meal planning, etc., is all really critical as well. What other questions did I get? I'm trying to make sure I answer all the questions that came through. I think I got everything. Okay, so I hope this one was educational. Again, we could do a full Facebook Live, and I know we will, coming up on many of these breast surgeries all on their own, as well as abdominoplasty all on its own. But kind of wanted to just focus on what it means to combine these procedures and talk about mommy makeover. So I hope that this was educational. And if any other questions come through, go ahead and message us and we'd be happy to answer them. And of course, you can always make an appointment to see us and be evaluated in the office in person by calling our office. So thank you so much, everybody, for tuning in, and I will see you next time. Have a good Thursday.